Welcome to the North West Training and Development Team and Pathways Daily Coronavirus Update. Today's update is about when to call health services if you or someone that you support is unwell or injured. This information has been adapted from information published by the Royal College of Paediatrics and Child Health. We've been asked to share it with you. While it's really important to follow government rules to stay at home during this period, it can be really confusing to know what to do if we or someone we care about is ill or injured. Remember, our NHS is still here to provide the same safe care they always have done. There are some times you really should still go to hospital or use another NHS service. Here is some advice to help. Look out for if you or anybody that you care for has any of these things. If they become pale, their skin is blotchy and reddish purple, and they are very cold to the touch. If their breathing isn't regular, or they start grunting. If they're having great difficulty breathing, they're getting upset or not responding. If they go blue round their lips. If they have a seizure or a fit, if they're very distressed or confused or not responding, if they have a rash that doesn't go away when you press on it, or they have testicular pain, especially if they're a teenager. If any of these things are happening, you need urgent help. You should go to the nearest A&E department or phone 999. If you or someone you care for is finding it hard to breathe, including if they're pulling in the muscles below or around their ribs, at their neck, or their head bobbing, if they seem dehydrated, like they've got a dry mouth, sunken eyes, no tears, they're drowsy, or they're weeing less than usual, if they're becoming very drowsy, or irritable, especially if they are still drowsy or irritable and their temperature is coming down, if they're shivering a lot or complaining of muscle pain. For babies under 3 months, if they have a temperature above 38 degrees C. For babies between 3 and 6 months with a temperature over 39 degrees C. For all children with a fever above 38 degrees C for more than 5 days, if they're getting worse or if you're worried, if they keep being sick or they keep having bad tummy pain, if they have blood in their poo or their wee, if they have any injury to their arms or legs that keeps hurting and they can't move them very well, if they have a head injury where they keep being sleepy or upset. If any of these are happening, then you need to see a doctor or a nurse today. Call your GP surgery or use NHS 111. The NHS is working for you. It might take longer than usual to get in touch with your GP or NHS 111 at this time. If it takes longer than 4 hours, you should go to your nearest A&E. If none of the things we've talked about are happening, you can carry on looking after yourself at home. You can still get information on the NHS website. You might find some of our other daily updates on what to do if you're ill useful. Take good care of yourself at home. If you are worried, use NHS 111. While it's still really important to follow the rules about staying at home to keep each other safe from coronavirus, our NHS is still here to give us safe care when we need it. If you or someone you care for is ill or injured, check which service is best to help you.